Liliana. And here we are today with Jackie Castro-Cooper, who just gave us a really wonderful demonstration of how she treats clients in her office. And so now we're going to go into how you can actually self-treat. So Jackie, tell us a little bit about what you teach people when they come to see you about like their own healing power. I love tapping into that.
It's really important that we bring our patients back to their own power to heal themselves, So asking them, do you go back to your doctor and ask the doctor if they want to keep you on those certain specific opioids, for example, and then we give them other things for self-treatment. So bringing back that power and energy that we have to heal ourselves, and also checking all the other things that kind of like what they're eating and so on, how they're sleeping, how they're dealing with personal family issues, and then self-treatments.
I love that. So you actually go into some of these things with people when they come see you?
Absolutely, yeah. We have to, I ask them, they don't have to tell me, but I ask them, if there's any other trauma other than the physical traumas, motor vehicle accident, is there also maybe abuse in the past, sexual abuse, verbal abuse, any kind of things that really stay within the fascial system and we don't even know it's there, like especially in that gut region.
Yes, I know PTSD is so rampant. I mean, there's so many of us suffer from it, and a lot of people don't know that they're affected. And I know you kind of follow the same belief that trauma can be held within the body.
Yes, absolutely. And so that's why we're detectives. We find the areas of inflammation and pain, and that's actually where we're holding on to what they call baggage. So we really need to focus on what is that our body is holding on to, and then we have to try to let it go.
Yes, and like our friend Betty Sue says, your issues are in the tissues.
Yes.
So let's take a look at these videos so that Jackie can show you how to self-treat. All right, Jackie, so here's your best client on the table. Take us through what you're doing with her.
Well, we just put the yellow balls right behind the neck, which is a beautiful place to treat. We hold a lot of tension. That's the autonomic nervous system there. And then we moved it down to the upper trap region. Now we're doing it right underneath the buttock region or upper low back SI joint region. That's where the piriformis is, and that's an area that we lock down. When we lock down our jaw, our belly tightens up and then our buttocks tightens.
This looks like something for headaches and vertigo.
Yes, this is treating the part of the head that sometimes gets a little off balance. So sometimes I'll see my patients that have a lot of headache issues. They will have a tremendous amount of imbalance in the zygomatic region and in the temporal region. So we just kind of go ahead and balance that off.
And so here's another amazing client of yours. So I understand that you treat pets, is that right?
Yes, I love treating pets. I'm doing an actual tail pull right now. I'm actually pulling the entire vertebrae, spinal cord, any restrictions that this beautiful dog Maggie has, we're pulling.
She looks like she's not really enjoying that ear pull, however.
She was actually pretty good with that. This is a loving, gentle technique. We have to remind all of our patients that they have to love themselves and care for themselves. And that's how we can go into the next paradigm, which is self-care, self-love.
Wonderful. And she's absolutely loving you and your treatment. So you can actually learn how to self-treat with Jackie once you go to see her in appointment. And so show us, these are the yellow balls that you use.
Yeah, I love these. So I teach people, like if they have low back issues, just to put them right here in their chair when they're driving, or a little bit lower, a little bit higher. People with really, really tight hamstrings, lots of pain, they just put them right there while they're watching TV. They put them behind their knees for inflammation behind the knees. So I use this all the time. I teach my patients to do it all the time too, and on their bellies.
Wonderful. And so what other information do you give people as far as their follow-up? So you treat them and they learn how to self-treat. If someone has an acute problem, like they fell down the stairs,
right?
What kind of follow-up would they need? Do they need to see you just one time, or do you recommend once a week for a certain amount of time? What's your frequency?
Right. Well, my wellness patients, of course, they're just going to come in once in a while. But some patients who have lots and lots of pain issues, what happens is I just tell them, try to come in at least twice a week for the first month. And this allows us to really address the fascial system and really let go of all those areas, because the fascial system needs that attention continuously to get rid of that inflammation, and that balances out the whole skeletal system.
Wonderful. So I understand that you also teach tapping.
Yes, I love emotional freedom technique. I took a course with Dr. Dawson Church. He has a wonderful manual called the EFT manual that I hope everyone will get. And it's just tapping in different parts of the body. But what it does is it actually changes the neural pathways and also changes 72 of our genes. So it's really simple, tapping in different parts of the body.
Wonderful. So you're talking about epigenetics and treating all sorts of other issues as well as just chronic pain. Find out where you can learn more about Jackie and myofascial release next.